All right, we're going to go ahead and get started. Good afternoon, everyone, and welcome to our media spokesperson training. For those of you that don't know me, my name is Jessica Smiley, formerly Dowdrick. I'm the communications director for Northeast Ohio. So I cover the Akron, Canton, and Youngstown markets in Ohio. I've been with the AHA for about 3 years now. And prior to coming to the AHA, I actually spent 5 years in TV news. I was a reporter, an anchor, did a couple of behind the scenes things as well. So a lot of the topics that we'll be discussing today during training, I do have experience with on the other side of things as the journalist and as the one conducting the interviews. So on behalf of your local AHA teams, I want to just thank you so much for taking the time and joining us today. We're so glad to have each and every one of you on this call. We're thankful that you're all willing to at least learn more about becoming a media spokesperson for the AHA. The American Heart Association depends on the time and talent of volunteers to help us create a healthier world for everyone, free of heart disease and stroke. So as you all know, you're truly at the heart of what we do. So again, thank you for being here. I want to get the conversation going today so I can better get to know who's on the call today and you can better get to know one another. So open up your chat box. That should be at the bottom of your screen. Click the little chat icon and type in there, tell us where you're joining us from today. We know there are people from across the Ohio and Kentucky area, so I'd love to hear where you guys are from. Lexington, Kentucky, Youngstown, Ohio, Akron, Toledo, Greene, great, Louisville, St. Paul, Minnesota. Awesome. Well, thank you guys all for taking the time to do that. And again, for joining us today. Just want to give you a little preview of what you're going to hear about today. So here is an outline of the next hour. And I want to assure all of you, most times media interviews are pretty simple. Oftentimes our media partners, they're our friends. They're helping us to spread our mission and education to better the health of the communities that we live in. So try to think of these interviews as more of a conversation between you and the journalist about whatever the interview topic may be. It may be Heart Walk, Heart Month, Go Red for Women. What I'm going to help with today is providing just some tips and tricks to help media interviews go smoothly and to make them as effortless and stress-free as possible for you guys, our volunteers. So we're going to be taking a look at the importance of media training, why we're doing this, how to prepare for an interview, giving an effective interview, tips for success, do's and don'ts. We are going to do some practice a little later. Don't worry, it will be very easy practice, nothing to worry about. And of course, feel free to raise your virtual hand at any time during the presentation today, or put your question in the chat box if you have one. I'm happy to answer as many questions as I can as we go along. And I'll also be, there will be a Q&A at the end as well. So again, I want to do a quick poll so that I can, again, better get to know you guys and what your experience is like with media interviews. So I'm asking you to submit your answer and let me know, how much experience do you have with media interviews? None. Maybe you've never done one before. Maybe it's a little, you've done one or two. Maybe it's a good amount. You've done them several times, but it's not something that you're doing on a regular basis. Or maybe it's a lot. Maybe you're a media interview expert. And if so, feel free to chime in anytime during the presentation today. All right, those answers are being submitted. So let's take a look. So most of you, about half of you, have done a media interview or two before. 31% of you never at all. No media experts in the room. So some of you, maybe media experts, but are afraid to say it. So if you have any tips or tricks going through, feel free to shout them out. All right. So throughout the day today, I'm going to be, I guess the next hour, not necessarily the day. I'm not going to take all of that time from you guys. I want to show you guys what great interviews look and sound like. So we're going to kick off today with one. This interview was done by Bill Epling, who was our 2021 Greater Akron Heart Walk Chair. He did this interview about a week leading up to our walk. So I'm going to let you guys take a listen to this and then take notes of the things that you think went really well in this interview and what you like.
Spats and Amanda, Akron's home of rock and roll, 97.5 WONE, one of the absolute best fundraisers happening this Saturday. And a guy who knows all about it. He's the president of Summa Care and the chair this year of the Akron Heart Walk. It's Bill Epley. And good morning, Bill. How are you?
Doing well, thanks. Thanks for having me this morning.
Absolutely. So it's back in person this year, right?
It is. We're thrilled that it's back in person this year. You know, we're going to do some things in a safe fashion, but it will be at Lock 3 in downtown Akron Saturday.
So one of the things that's different this year, because we are doing it in person again, you are doing it in person again, but you're going to be setting people off in waves, obviously to keep social distancing. But another really cool thing I saw is you can participate in the Heart Walk from anywhere. How does that work?
Yeah, Amanda, that's a great point. So the theme this year is Heart Walk Here. And because of the pandemic, we're asking walkers to either walk at Lock 3 with us in downtown Akron at the event, or wherever you feel inspired to walk, you know, at your house, on a path, on a trail, around the neighborhood. We know everyone has different comfort levels at this point in the pandemic, and so we're trying to give people options at this point. But we are excited about, being able to be in person again at Lock 3. And again, because of the pandemic, we'll have walkers step off at the event at different start times in order to avoid crowding. Those times will be between 8:30 and 9:30 a.m., and they'll be organized by company. So we'll let walkers know what their start time is prior to the walk. So we're coming together physically spaced, but connected in the mission of the American Heart Association at the walk this year.
And you guys have so many cool things going on with this. The one thing I really like, as competitive as I am as a person, it's a non-competitive walk. You just get out there and do your thing. The main point of it is raising awareness and raising those funds. But you guys made a playlist for your walkers?
We did. One of the new options this year is we added a playlist that walkers can listen to while they walk. We've put together some of our favorite music along with some heart health education messaging and information about this year's walk. So you'll be able to find that playlist the week of the Heart Walk on our website at heart.org/Akron Walk. And also, Amanda, just to point out, because it is the 20th anniversary of the events that happened on 9/11/2001, we're actually having a moment of silence at the event and also a flyover at this year's walk to recognize and pay tribute to those we lost and were affected by 9/11.
That's awesome.
That is phenomenal.
It's so awesome that we're able to do this, in person again this year and recognize the significance not only of the American Heart Association, but of September the 11th as well. So can we have any previews now? Bill, what do you like? What would be in your playlist?
Aerosmith, maybe?
Walk This Way, yeah?
I kind of like that. That's classic. Walk This Way, kind of a classic rock kind of a guy. So anything Aerosmith, Bob Seger, those kind of guys would be on my playlist. So.
Excellent.
And so how do people sign up? Can they still get involved with this? Because we know the walk is this Saturday. What do they do?
So individuals and teams can register at heart.org/Akron Walk. Again, that's heart.org/Akron Walk. You can donate through October 30th online, actually. And as Amanda mentioned, we'll have 1 mile and 3 mile routes. It's a non-competitive event that's really just focused on groundbreaking, helping to fund groundbreaking research and life-saving programs. As we all know, heart disease is still the #1 killer in the United States, despite the toll that COVID has had on everyone. So a lot of good effort and energy going towards really good fundraising and for research and innovation. So we're just excited to be able to be back in person safely this year at Lock 3.
That's right. It's the Akron Heart Walk this Saturday. Thank you so much, Bill.
Thank you very much. Take care.
All right. So that interview was done, virtually. Bill was actually on vacation doing the interview from his cell phone during the pandemic, and obviously the radio host in studio. I wanted to ask you guys, what did you like about this interview? What did you think went really well? What tips do you come away with after listening to that for any interview you may be interested in doing? All right, he sounds prepared, a natural conversation. You guys are saying you can tell he really knows his stuff. He's confident about what he's talking about, energetic. Yep, mentions heart disease facts and why we're walking. Sounded very comfortable, like he knew it well, wasn't reading talking points. That's actually what I like the most about it is I can tell, not I can tell, but I provided him with talking points and he's following those. But as a listener, it doesn't sound like he's following those. Like everyone has said in the chat, he sounds very confident. He knows what's happening and he's not reading it off of a piece of paper. So All right. Thank you, guys. So why is media training important? I know that interacting with the media can be stressful for some people. Most interviews with the media, like I mentioned earlier, are pretty simple and straightforward, but that doesn't mean that they don't have the potential to make a big impact on the AHA's reputation. So big or small, every media outlet, journalist, influencer, they all have the opportunity to help, enhance, or hurt the AHA brand. So that's why it's vital to take every media interaction seriously by preparing and practicing ahead of time. Media training, it helps teach individuals how to coherently and effectively interact with those reporters and journalists and other members of the media during those interviews. It stops any potential people from being misquoted or taken out of context or any miscommunication. So I just want to be clear, the goal for a media interview is not to be perfect. No media interview is perfect. It's okay to mess up. We all mess up. This training is all about just giving you some tips to be a little better and improve the media interviews that you're doing already. All right, so just some information about partnering with your communications director. Many of you do this already. It's just a friendly reminder. You and your communications director should be a little bit like LeBron James and Dwayne Wade circa 2010, 2014. Your teammates, your partners in crime, you're in it together. So just a few reminders for you. Always reach out to your comms director before you agree to do an interview. Most times the media will be coming to your comms director and then they'll be reaching out to you, but there are times that it might happen in that reverse order. So just always make sure that if you're speaking on behalf of the AHA, that the comms director is aware. If you're at an event and the media shows up, make sure you go alert the communications director. Most times they probably will be aware that they're already there, but there are other times where the communications directors are running around doing multiple things at once. So just to make sure that they know is always important. Ask any questions you have to your communications director ahead of the interview. Again, they're your teammate, they're there to help you. And oftentimes it's important to know that your communications director will prepare you with talking points when there's time. They're not just gonna throw you out there and expect for you to figure it out by yourself. So when there's time, they will be providing you with talking points, so you have that for your interview. Speaking of timeliness, often the media wants these interviews as soon as possible. They're typically stories that they're working on. They may start working on it at 9 in the morning and it'll air on the 5 o'clock newscast. So when they say they want an interview, most times they want it like yesterday. This happens a lot, so it's important when your comms director reaches out to you that you can expect probably a quick turnaround oftentimes. The next interview I want to show you as an example is one of those fast-paced turnarounds that I was talking about, and it's another great example of a successful interview. So new research came out about a month or so ago from the U.S. Preventative Services Task Force. They issued a draft of new suggestions for taking aspirin in regard to heart health. So that same day, we got a couple of media requests, and one of them was from WYTV in Youngstown, one of our media partners. They wanted someone live on their 7 p.m. show. So we reached out to cardiologist, Dr. Justin Dunn, who was also our former board president, and he agreed to do multiple interviews on the topic that day. And the one I'm about to show you is just one of them. This is one of those situations. I didn't have time to prepare him with talking points. This was a quick turnaround. Instead, I sent him an article about the AHA's stance on taking aspirin for heart health, and off he went. So we are going to take a look.
A group called the U.S. Preventative Services Task Force today issued a draft of new suggestions for taking aspirin for heart health. The general takeaway is there are more risks associated with taking aspirin than there are benefits. So what does this mean for the average person? We're happy to be joined by Dr. Justin Dunn from Summa Health. He's a cardiologist and board member of the American Heart Association of Northeast Ohio. Dr. Dunn, thank you so much for joining us tonight.
My pleasure. Thank you for having me.
All right, so we'll start off with this. How important are today's recommendations from the U.S. Preventative Services Task Force?
Well, I think these are very important. There's been a lot of controversy recently about patients taking aspirin as primary prevention, meaning patients who have never had a heart attack or stroke, or never had stents in their heart, or never had bypass surgery. So these are kind of patients who might have some risk factors, and might be getting up in the years and say, should I take an aspirin every day? The data with recent trials and recent analyses suggests maybe aspirin every day for patients who have never had issues with their heart is not such a good idea. Maybe it could cause more harm than good.
And we have heard from other medical groups that today's report is a little late coming from the task force.
Yeah, the task force released some guidelines in 2016 that were a little bit different than this. And they still suggested maybe patients in their 60s would benefit from primary prevention aspirin. The American Heart Association, American College of Cardiology came out in 2019 and kind of said, look, unless you have a lot of risk factors and very few patients, aspirin may not be a benefit. And they kind of suggested just living a healthy lifestyle and gave some guidelines along those lines. One thing I want to clarify here, though, is that this is for primary prevention of cardiac disease, heart attack and stroke. If you have had a heart attack or a stroke, or if you have coronary stents in your heart, or if you've had bypass surgery, those patients still benefit from taking aspirin. Those are patients who are taking it for secondary prevention. These patients that we're talking about today in these guidelines are patients who have never had an issue with their heart, and this is only for primary prevention.
And is there a difference in the benefits or risks based on different age groups here?
Yeah, there's a difference, so the shift is now toward a more narrow age group. So it used to be the U.S. Preventive Services Task Force said, if you're 50 to 59, you probably benefit. If you're 60 to 69, you may benefit. Now they're saying, look, if you're 50 to 59, you may benefit. If you're 60 to 69, you probably don't benefit, and it may cause harm. But they are creeping into the 40 to 49 range, saying there's some data suggesting maybe if you have a lot of risk factors, you might benefit from taking aspirin every day, but certainly is worth a discussion with your doctor.
And in the final seconds here, Dr. Dunn, what else can people do to reduce the risk of a heart attack regardless of your age?
Well, I think the American Heart Association and organizations like the AHA have been saying for years, healthy lifestyle, healthy diet, exercise 30 to 60 minutes a day for 5 to 6 days a week, and avoid cigarettes and e-cigarettes, and just live a generally healthy lifestyle. You can listen to your doctor's advice, and you can hopefully prevent that first heart attack or stroke.
Dr. Justin Dunn, thank you so much for joining us tonight and offering your expertise into this issue that I know so many people had so many questions about today.
My pleasure. Thank you.
Thank you.
All right, so open up your chat box and let me know in there, what did you think went well with this interview with Dr. Dunn? As a physician, I'm sure he knows lots of fancy medical terms. He spoke very simple language that the average viewer could follow. Yep, he was ready with a great soundbite at the end about prevention. Yep, and we'll talk a little bit about sound bites here in a second. Doesn't use a lot of filler words. Yeah, I agree, Courtney. Very concise, easy to understand, mentions the American Heart Association. Yes, so all of those things, I definitely agree. Dr. Dunn is, from that poll in the beginning, I would say a media expert. He's someone we go to a lot to speak to the media when that opportunity arises. All right, so framing your interview, what is your role for these interviews? Typically, you could be talking to heart and stroke patients. Sometimes it's the entire community. Your interview may last 15 to 20 minutes, but only a small portion of that interview will be used in the story. So don't be afraid to repeat yourself and hit on your key points multiple times. You may be talking about an event, it may be health messages. Whatever those key messages are, identify those before your interview and make sure you're hitting on those several times. Emphasize those points and aim to speak in what we call sound bites. They're little snippets of the interview, maybe 7 to 10 seconds that air. The Dr. Dunn interview was live, so that was a longer interview, but you'll see another example a little bit later where it's smaller sound bites of things, that again might have been a longer interview. And who's your audience? It really does depend on the story and the outlet. If you're talking about the benefits of healthy eating and that the benefits of for the heart, then you're really talking to the entire population. That's someone everyone can relate to. Other times it's a more narrow audience. So say you're talking about research taking aspirin, like Dr. Dunn was referring to prevent a second heart attack, then obviously that's more specific. That audience is to those who have suffered a first heart attack. So that'll vary. If you're talking to the Business Journal, obviously expect your audience to be more business professionals. It's the local news station, more of a broader audience there. Identifying yourself for the interview. This is something that both of the two examples that I've shown you so far, both of the gentlemen did a really great job at. Reporters will ask you for your title. They'll ask you for your name and also your title. Make sure that when you answer that question that you're giving them a position with the AHA and with your organization. So you can see in the example on your screen, we had Dr. Rami Kaffa, who's also one of our board members, doing an interview about World Heart Day. And you can see on the screen, they use his title as Mercy Health Cardiologist, his day job, and then his volunteer position with the American Heart Association as a board member. So just making sure you get the recognition of the American Heart Association out there, especially when you're speaking on behalf of the AHA. What to wear, looks are just as important as you are. Just things to note, solid, darker colors always look better on camera. Avoid all white, all black, busy patterns, polka dots, plaid, anything like that. And feel free to wear an outfit that fits the story. If you're talking about what it's like to be in the emergency room during COVID, wear your scrubs. If it's an interview about Heart Month, obviously, or wear Red Day, red would be the best color to wear. So feel free to wear whatever is fitting to the story that you're talking about. Jewelry, just something to note, can distract from you and your message. Try to avoid large, bulky pieces of jewelry because people will end up staring at that and then not listen to what you're actually saying. All right, preparing for the interview. The more comfortable you are talking about whatever the subject is of the interview, the less likely it is that you'll need to practice. You could tell Dr. Dunn was very comfortable talking about heart health and how it relates to aspirin and taking aspirin. But if there's language in your talking points that you may not be as comfortable with, maybe it's around health equity, that's something that you'll probably want to practice speaking to and about. So ways that you can do that, a mock interview with the comms director, just ask them. I'm sure that all of our comms directors would be willing to help in that way, or you can do a mock interview with someone else. Maybe it's a spouse. You can practice aloud alone in front of a mirror, in front of peers. Maybe your coworkers have some extra time during a lunch break. You can always record yourself and watch it back, or rehearse in a similar situation. All right, so how do you give an effective interview? So visualize is the first pointer. Use descriptions that paint a picture in the viewers or listeners' minds that support what you're saying. Don't memorize your messages, own them. Both of the examples that I've shown you so far, they did that. It didn't seem like they were reading sentences off of a piece of paper. They knew what they wanted to say and worded it in a way that was comfortable for them and conversational with the journalist and the interviewer. So try to tell it like a story. That'll make it the easiest for you, I think. Personalize, you're a part of the AHA. That's why you're speaking on behalf of the AHA. So own that, include yourself. When you're talking about the AHA, use we and use us. Simplify, reduce complex issues to relatable situations. Put yourself in the situation of the viewer or the reader in their perspective. How can you take what you're saying and put it into layman's terms? Easier to understand, and the more that the audience can understand, the more they're going to take away from the interview and what you're saying. Take charge, it's your interview. Get the details and information across that you want. So I'm going to be teaching you 2 techniques in just a few minutes to help you do that. Some quick tips for a successful interview. Again, the markets that we work in and the topics that we're discussing, the media typically is very supportive. You don't have to worry much about hard-hitting questions or being misquoted purposely, but these things are just some good reminders for you. Always be honest and candid. It's okay to not know the answer. And if you don't know the answer, say that. Let the reporter know that you aren't sure, but that you'll find out and you'll get back to them. And you can work with your comms director to figure out the answer and get them the information that they asked for. Think about what you want to say before you're interviewed. Make notes. Consider what you want the headline or those key messages to be, and make sure you have those in your brain. You know what you want to say. Correct yourself if you misspeak. What I actually meant to say was, and then follow it with that. Be concise, keep it simple. You're talking to the public, not professionals in the field of what you're talking about. And I want you guys to know that flubs are okay. In video interviews, again, they're using 7 to 10 seconds of the interview. Maybe they'll use 7 to 10 seconds 1 or 2 times, but they're using these sound bites. So if you mess up, remember it's okay to stop and to start over, especially if it's a recorded interview. Some don'ts, don't get bogged down in technical jargon that most people don't know what it means. Don't answer any questions you're unable to speak to. It's okay to be honest that that's outside of your expertise, and you'll get them the information. Don't drift off topic. If this happens, I'm going to be teaching you a technique here in a second to be able to get back on topic. Don't rush, think about your answers before you say them. And use silence to drive home your message. If there's a break in the conversation, know what those key messages are and make sure you're repeating those and getting that information out there again. All right, media interview tips and tricks. We've talked about this, I feel like, a little bit already, but repetition equals retention. You can never mention your key messages or the American Heart Association too much. It's okay to repeat yourself. Actually better if you repeat yourself, especially if it's those key messages and points you're trying to get across. Take the gift. So some journalists will ask an open-ended question like, anything else you'd like to add? When I was a TV news reporter, that was always the last question I asked interviewees. And believe it or not, that was oftentimes when you got the best information from them. So think about that. That's called your gift, the media's gift to you. Is there anything else you want to add? What have you not said yet that you want to make sure you get across? It's a great opportunity to either repeat those key messages or say something that you haven't had the chance to say yet. All right, we're going to look at one more interview to show you another example, break things up a little bit. So again, I'm going to be sharing this with you, and then take notes of what you think went well and what you liked, and share those with me in the chat afterwards.
Every year, thousands pack into downtown Dayton to walk or run. They do it for a family member, a friend, or themselves, and it raises awareness and dollars for the American Heart Association. But this year, the Dayton Heart Walk is going virtual, and although it's not what anyone had planned on, it has not stopped the incredible enthusiasm and support to fight heart disease and stroke. The sounds have become synonymous with fall. Thousands of people coming together in downtown Dayton to stand up to heart disease and stroke. People like Katie Radloff.
Well, about 11 years ago, I was diagnosed with cardiomyopathy and had a implanted defibrillator placed.
Radloff's diagnosis meant she had a weakened heart muscle. Her energy no longer what it used to be.
When I was diagnosed, my kids were very young, and it was, how do I do enough to make sure that they don't see this as being a limit?
She found a local heart walk put on by the American Heart Association and decided to give it a shot.
First of all, the people that work there are phenomenal and wonderfully supportive. And all the events, when you get with a group of people who are like-minded in helping people and fighting against heart disease and trying to make a change, it is very empowering.
Soon, making a change meant collecting donations. It started slow, but Radloff is now consistently one of the top fundraisers for the Dayton Heart Walk every year.
I could give personal examples of, when you donate this money, this is what it has done to help me and make my life better. And donations just come rolling in when that happens.
And though this year the walk is virtual, Radloff says the enthusiasm and importance of the event has not changed.
1 in 3 people will be affected by heart disease in their life, and that's as a patient, not a mother, a father, a sister, or brother. 1 in 3 people, and it's 80% preventable. So if we all start working now, we can make that number change, and change for the better, because nobody wants to be a heart patient. It's hard.
A hard thing that thousands here are trying to change. And I'm very proud to once again help MC this great event. If you would like to register for it, we posted a link on our website, Dayton247now.com. Just click on news and then click on news links.
All right, so tell me in the chat box, what did you guys like about that interview? What did you think went really well? I'll start with, I thought that she was a survivor sharing her story, but was so knowledgeable about how many people are affected by heart disease. And I think that would really resonate with the viewers of, it's not just me, it could be you too. Courtney says you can see her passion, repeated the 1 in 3 statistic twice. Yep, very passionate, reflected on her personal story. Yep, great background for the virtual interview. Yep. So all of those things, she did a really great job in our Dayton markets. All right, so here's the 2 techniques that I've been previewing a little bit throughout the day. 2 things to help you control the interview, bridging and what's called flagging. So bridging is a technique that you'll use to move the conversation from a negative or an unhelpful question posed by the interviewer and get it back to what it is you want to be talking about. Whereas flagging signals to a reporter that the information you're about to share is really important, so listen up. There are 2 different methods to control the interview, and we're going to dive into each of those. If you don't remember anything else from this media training, these are the 2 things that I want you to take away from it. Again, bridging is the technique, one of the cornerstones of media training. It's a tool to help you control that interview. It allows the interviewee to move the conversation from something maybe that they don't want to be talking about, but that was posed by the interviewer, and take it to their key messages and shift the interview into what it is they want to be talking about, their own agenda. The key to bridging successfully, and the challenge for most people we find, is to develop a phrase or form of words that will allow you to get from the interviewer's question to your own key message. So some of those examples are here on your screen that you could use. The reality is, you make a good point, but what's important to remember is, moving forward with that. So I'll give you an example. Say I'm doing an interview about Go Red for Women, because that'll be the next campaign that'll be coming up in my markets. And the reporter asks me, why is this campaign only focused on women's heart health and not men's? So my response to that may be, in 2004, the AHA faced a challenge. Cardiovascular disease claimed the lives of nearly 500,000 American women each year, yet women were not paying attention. In fact, even some of them dismissed it as an older man's disease. So to dispel the myths and raise awareness of heart disease and stroke as the #1 killer of women, the American Heart Association created Go Red for Women. Cardiovascular disease is the #1 killer of all Americans, men and women alike. The reality is, for women, cardiovascular disease causes 1 in 3 deaths each year. That's approximately 1 woman every minute. So awareness is critical. The more a woman knows about heart disease, the better chance she has of beating it. So fortunately, a majority of the time, cardiovascular disease may be prevented with some education and action. So obviously I had time to prepare an answer to a question like that. But the goal of your talking points and preparation with the communications director is for you to be able to do the same thing. The bridging technique I used was the reality is, that's what I wanted people to remember. Cardiovascular disease causes 1 in 3 women's deaths each year. Does anyone have any questions about bridging before I move forward? And again, you will have an opportunity at the end as well if you want to ask any questions. If not, I'll move on to flagging. So this is a bit of an easier technique, I would say, in comparison to bridging. Flagging again signals to a reporter like this is the information that you're about to share and it's really important. So before responding fully to whatever question it is that's asked, a flag provides a preamble to ensure the message that is coming off is tagged as important in the reporter or the editor's brain. Flagging helps you drive an interview and keep a reporter focused on your news, the key messages you're trying to get across, the way you want it to appear either in print or on air. So here are some of the ways that you can do that. The critical point is It's important to point out, it all boils down to. So again, there are these phrases that will help you alert the journalist or the team behind the scenes that what you're about to say is really important. Listen up, I'm going to tell you exactly what you want to hear. That's what you're saying when you are flagging and using these phrases. So to kind of bring it back home to the AHA, here's an example. Say I'm doing an interview about the It's My Time campaign. So it's a newer campaign from the AHA that's educating the community about the connection between stress and physical health. And it helps them take actionable steps to reduce chronic stress and improve overall health and well-being. So say a reporter asks me, is there anything else you want to add? We talked about this a little bit earlier. While I may have already hit on these key points during the interview, I'll use the flagging technique by answering, between work, family obligations and a constantly changing world around us, people in the US are stressed. In fact, workers in the US are among the most stressed in the world. Now, while some stress can be good for us, constant or chronic stress can have real consequences on both emotional and physical health. The most important thing for people to remember is chronic stress does not have to be the norm. And according to the AHA, reducing stress and cultivating a positive mindset can improve health and well-being. Managing stress means managing your health, so reclaim control of your schedule and build in time to invest in a healthier you. Step away from distractions and to-do lists to go for a walk or maybe meditate. Do what you need to recharge. Because if you don't take back your time, something else will. Again, I had time, to prepare for something like that, but that should be something that you're prepared for always, that anything else you want to add, know what you want to say there, because it is often the last question that reporters will ask you. All right, just some more quick tips and tricks. Make and hold eye contact. Again, it's like you're having a conversation. Always assume your mic is on. So coming from a TV news background, they may not necessarily mean to have your mic on, but it happens by accident sometimes. There were times when I'd be anchoring the show and my audio was coming across the TV over the commercials because someone forgot to turn off my mic. So speaking from experience, always just assume the microphone is on. When sitting during an interview, shoulders back, sit up straight, look confident in what it is you're talking about. You can use subtle hand gestures, whatever's natural to you. Don't overthink that by any means. Again, you just have a few seconds to tell your story or to really sell your story. Again, might be a 15-minute interview, but what is that key message you want to get across in 7 to 10 seconds? Define your key messages and repeat those. Turn off your phone. You don't want those to ring during an interview. Spit out your gum. Remove coins from your pocket if you still carry coins. I oftentimes don't even have pockets, let alone coins these days. Have a headline, again, your key messages, know what it is you want to get across. Don't use any jargon. At the AHA, we use a lot of jargon. Even as a staff member, I still am like, what does this mean? We have so many abbreviations for things. So don't use abbreviations, don't use jargons. Say the entire phrase so people know what it is you're talking about and there's no confusion. Be careful when stating numbers and statistics. If it's a powerful number or statistic, such as in the last interview, the 1 in 3 women statistic, that stands out, that resonates with people. But the more detailed, complicated ones aren't ones that people are going to necessarily remember and walk away with. So look at the question as the starting point, not a limit, and tell stories. Stories are what stick. So before we practice quickly, I'm going to go over some AHA messaging. Most of you already know this, but just a real brief overview. Our mission statement, hopefully you've heard before, is to be a relentless force for a world of longer, healthier lives. And at the AHA, our job is easy to define. We save and improve lives. Our mission statement makes that clear, but there's a lot more to it. Everything we do is grounded in our guiding values, which you can see on the screen right here. So how we do our work as a catalyst to maximize health impact is defined by our strategic value proposition. You can see that at the bottom of the slide here. And I will be sending this deck out to everyone on the call afterwards. So you'll have all of this as well. Our 2024 impact goal, all of our work is dedicated to achieving this. This impact goal was strategically developed and is based on the latest science and data. And it says, every person deserves the opportunity for a full, healthy life. As champions for health equity, by 2024, the American Heart Association will advance cardiovascular health for all, including identifying and removing barriers to healthcare access and quality. You'll see that there's a large focus on health equity here. And when we talk about health equity, what we mean is health equity is a state that would be achieved if all people had the just opportunity to be healthy. And it's important to know that we always drive to that impact goal, and we always do it with equity at the core of what we do. So this graph here that you see, that outlines how that happens. Again, I'm not going to go into details of this just because of time, but I will be sending this out to you afterwards, so you'll have that. All right, so I know it's the time that everyone has been looking for. We are going to practice. So let me drop something in the chat box for all of you. All right, so that is sending. You should see a media training file that says Go Red for Women talking points in the chat box. I want you to download that because you're going to be going into breakout rooms in just a second, and you're going to need that. And when you go into those breakout rooms, it will disappear from the chat box because you'll be going into a different room. If for some reason you don't see it in the chat box because of technical issues, it is in your email box as well. Whatever email address you use to sign up for today's training, a copy of this document that you'll need for our breakout rooms is in your email as well. So you're going to be paired off. You're going into breakout rooms, and the topic is Heart Month. So you guys are going to role play a little bit. Again, 2 of you. So one of you will be the AHA volunteer answering questions, and the other will play the reporter. So you'll have 10 minutes, and I want to make sure that you both partners have the opportunity to play both roles. So you can take a couple minutes to read over the talking points. There are sample questions if you're the reporter in there. So take a look at them, and then role play being the spokesperson and the reporter, switch roles, and then after 10 minutes, you'll be directed back here. All right, so we will see you soon. You'll automatically be directed into your breakout rooms. All right, it looks like everyone is back in the main room. Again, I hope that was really helpful for you guys. Before we go to the Q&A, does anyone want to share something that they learned from that experience? Something that went well, something that you're glad you were able to practice, something that you were able to put into practice that you learned today? That's okay. I'll let you sleep on it and you can report back later. All right, so just before we end today, question and answers. Does anyone have any questions that I can answer for you before we end today? You can either type them in the chat box or come off mute, whatever you're most comfortable with.
Hey, Jessica, this is Jeff Hallam. And I was telling Michael earlier in the breakout room that I did a similar training when I was down in Columbus with WBNS TV, with Dave Kaler and other groups. And one of the things that he probably said it 20 times while we were being trained, to never say to a reporter, "That's a really good question." And I don't know, because I hear it a lot and that's stuck with me. This was 20 some years ago, probably 30 years ago that I did this, 20 years ago. And, you hear that a lot, at least I hear it a lot. Maybe I'm more sensitive to it, that when people are being interviewed, they go, "Well, that's a really good question." And then they respond. So I don't know if they're using it as a filler to give them time to think about what they want to say. So what is a different way to give yourself, 5 seconds, 3 seconds to think about what you want to respond to?
I think the silence is okay. I think it's okay to take 5 seconds before speaking. If it's a live interview, obviously it's a little bit different, but especially for recorded interviews, it's okay to stop, think about what you want to say before saying it. Like you said, I think that is a filler. And I actually, as a reporter, I didn't get that very often. And when I did, it was something I edited out of the soundbite. It wasn't something that typically made the air, but I appreciate you bringing that up, Jeff. Anyone else have any other questions before we conclude today? I want to be cognizant of everyone's time. If you think of anything after the training, feel free to send me an email. So here's some of the contact information for your local communications directors. If you don't have that already, I cover Northeast Ohio. Afton, who's on the call, covers Kentucky. And Katie is our new communications director in Dayton and Toledo. She actually hasn't even started yet. She starts on Monday. So you're getting that information a little bit early. Don't reach out to her before Monday. And then also our Midwest VP and RVP, Jen and Laura, they're always happy to help. Obviously go to your communications directors and your EDs first, but for some reason they're on vacation or you can't get a hold of them, Jen and Laura are great resources for you as well. And again, I'll send all this information out to you along with the entire deck today. So again, thank you so much for joining us. Feel free to reach out with any other questions you may have. And if there's any way that I can help you in the future, just please let me know. Hope everyone has a great day.